Close your eyes for a moment and imagine this scenario. You trust your doctor completely. You've been seeing him for years. He has a great reputation, beautiful offices, and he always seems so caring and knowledgeable. One day, you go in for a routine checkup. He runs some tests. A few days later, he calls you into his office with a serious look on his face. "I'm sorry to tell you this," he says, "but you have cancer." Your world stops. Your heart races. You think about your family, your grandchildren, all the things you still want to do. He tells you that you need to start chemotherapy immediately. "We can't waste any time," he insists. So you do. You start treatment right away. Over the next months and years, you lose your hair. Your teeth start falling out. You're constantly exhausted and sick. You drain your retirement savings on treatments. Your family watches you suffer, helpless to do anything. 3 years later, you're sitting in a different doctor's office. This new doctor is looking at your charts with a confused expression. "I don't understand," she says. "According to these test results, you never had cancer. You might think this is a nightmare, a horror movie plot, something that could never happen in real life. But I'm about to tell you a true story. A story about a doctor who did exactly this to over 553 patients. Most of them were seniors over 60 years old. And he did it deliberately, knowingly, for one reason: money." This is the story of Dr. Farid Fata, the most egregious medical fraud case in American history. But more importantly, by the end of this video, I'm going to give you 7 specific warning signs that can protect you and your loved ones from ever becoming a victim like this. Stay with me. This information could literally save your life.
He told me that I was terminal and that I was going to die.
I was very scared.
I received my medical training at the Memorial Sloan Kettering Cancer Center in New York.
Let me start by telling you who Farid Fata was, because understanding this is crucial to understanding how he got away with it for so long. Farid Fata was born in Lebanon in 1965 to a Melkite Catholic family. After obtaining a medical degree there in 1992, he emigrated to the United States to begin his medical career. He became a hematologist and oncologist, a doctor who specializes in blood disorders and cancer. Now here's what made him so dangerous. He wasn't some shady character operating out of a back alley. Quite the opposite. Fata built a medical empire in the Detroit suburbs. He owned Michigan Hematology Oncology, which became one of the largest cancer practices in Michigan. At its peak, his practice was treating 17,000 patients at clinics in 7 different cities. Think about that for a moment. 17,000 patients. That's like filling a small stadium with people who trusted him with their lives. He lived in a sprawling mansion in ritzy Oakland Township. His offices were upscale, modern, impressive. When you walked in, everything screamed success and cutting-edge medicine. But here's what made him particularly believable. Fata acquired a sterling reputation as one of the best cancer specialists in the Detroit area. He was known for his aggressive approach to treatment, giving higher doses of chemotherapy drugs at a more frequent rate, a protocol he called European protocol. People came to him from all over Michigan. They brought their elderly parents. They referred their friends. Because when you're facing cancer, you want the best, most aggressive treatment possible. Right? Fata built a completely self-contained medical system. He had his own laboratory, his own pharmacy, his own radiation treatment facility, and his own diagnostic center. This meant that once you became his patient, everything happened within his empire. You never had to go anywhere else. At the time, people thought this was convenient. Looking back, we now understand it was a trap. Fata was so protective of his patients. Secretive, actually, that he carried a pager with no backup, answering all calls himself. When other doctors asked him to carry a cell phone like normal physicians, he would always say, "Let's work on it," but never did. He never wanted anyone else looking at his patients. And now we know why. His wife, Samar, helped run the business side of his practice as chief executive officer and chief financial officer of his companies. Together, they built what looked like a model medical practice. But behind the marble counters and the expensive equipment, something evil was happening. Now I need to tell you exactly what Farid Fata did. I'm going to share some specific cases with you, and I warn you, these stories are difficult to hear, but they're important because they'll help you recognize the warning signs later. In his guilty plea, Fata admitted to prescribing and administering unnecessary aggressive chemotherapy, cancer treatments, intravenous iron and other infusion therapies to 553 individual patients in order to increase his billings to Medicare and other insurance companies. He then submitted fraudulent claims to Medicare and other insurers for these unnecessary treatments. But let's be clear about what that really means. There were 3 types of victims. First, completely healthy people he told had cancer. Let me tell you about Robert Sobire. Robert was a retired auto plant supervisor in his early 60s. He went to Fata and was given chemotherapy treatments for 2.5 years. But here's the truth. He never had cancer. Not even a little bit. The chemotherapy treatments were so strong that his teeth fell out and his jaw started to change shape. Years after finding out he didn't have cancer, he had lost all but one of his teeth. Imagine that. Imagine losing almost all your teeth, suffering for 2.5 years, spending your retirement savings, putting your family through hell, all for a disease you never had, Robert told reporters. It just gets to me. What was the motivation? Why me? I don't know what I ever do to him. Then there's Patty Hester. Patty worked in an emergency room. She went to Fata in 2010 because another doctor recommended him after her white blood cell counts were low. Fata was renowned. His website and flyers proclaimed he was world-renowned. When you went to his office, he was the top doctor. Patty was devastated when Fata told her she had myelodysplastic syndrome, or MDS, a serious blood disorder. He said, "You need to start on chemo, like immediately," Hester recalled. After debating with him, he instead put her on expensive iron treatments and eventually blood plasma treatments. She was still taking those pricey plasma treatments when her coworkers made her come to the TV to see the news. Her doctor had been arrested. Patty Hester did not have cancer. She developed high blood pressure and hair loss from the unnecessary treatments and the stress of the ordeal. And there was Steve Skripchak, 68 years old. Steve was told he had non-Hodgkin's lymphoma. He had a meaty port surgically implanted in his chest, a device that allows chemotherapy drugs to be delivered directly into your bloodstream. He underwent more than 25 treatments with chemotherapy in just 6 months. After Fata's arrest in 2013, Steve went to 2 other oncologists. They both told him the same thing. He never had cancer. Second, people who did have cancer but were given excessive harmful treatment. Now, the second category of victims is particularly insidious because these people actually did have cancer, but Fata overtreated them so severely that he caused permanent damage to their bodies. Let me tell you about Christopher Sneary. Chris came to Fata to be treated for testicular cancer from 2010 to 2013. This is actually one of the most treatable forms of cancer when caught early. But Fata gave him massive overdoses of chemotherapy. Chris ended up with heart and liver damage. His kidneys nearly failed. And here's the worst part. Fata had one of his testicles removed, a procedure that was medically unnecessary. When Chris finally saw new doctors after Fata's arrest, they told him they were appalled that I was sitting there in front of them after so many life-threatening treatments that were nearly fatal. Chris testified in court. I gave full and total trust to this man to get me and my family through this journey. I was about to begin. Dr. Fata took full advantage of my trust in him, my fear of dying, and most of all, my top-of-the-line health insurance. Then there was a patient identified in court, only as CC, to protect her privacy. Due to 177 unnecessary chemotherapy treatments, she developed problems with her bladder, bowel, and kidneys, so serious that she could no longer perform basic tasks. 177 treatments. Think about that number. Another patient, Maggie Dorsey, was deliberately misdiagnosed with multiple myeloma and treated with bortezomib, a powerful chemotherapy drug. She tearfully described living with the adverse effects, which include severe osteoporosis and neuropathy. "I have days where I cannot stand," Dorsey said. "Most nights, the pain is too great to allow me to sleep." Third, terminal patients treated until their last breath. The third category is perhaps the cruelest of all. Geraldine Parkin, the wife of one of Fata's patients, testified that many patients were tortured until their last breaths. These were people who were genuinely dying, who should have been receiving compassionate hospice care, allowed to spend their final days with family in peace. Instead, Fata kept them on chemotherapy regimens, billing Medicare and insurance companies until the very end, making their deaths more painful and their families' grief more traumatic. Now you might be wondering, how much money are we talking about here? The total fraud was $34 million that Fata billed to Medicare and private insurance companies. When he was caught, the court ordered him to forfeit $17.6 million. But here's what made his system so effective at avoiding detection. He used fraudulent reimbursements to build 6 clinics, a diagnostic testing center, a pharmacy, and a radiation testing facility that allowed him to keep patients within the confines of his practice. Not only did this allow him to submit more claims, it prevented outsiders from looking at patient files. It was a closed loop. You came to his clinic, got tested in his lab, had your prescriptions filled at his pharmacy, received radiation at his facility, and were monitored by his staff. No outside eyes ever saw your complete medical picture. On top of the fake cancer treatments, Fata also admitted to soliciting kickbacks from Guardian Angel Hospice and Guardian Angel Home Healthcare in exchange for his referral of patients to those facilities. He was making money from every angle. Fake diagnoses, unnecessary treatments, kickbacks from referrals. To him, patients weren't people. As federal prosecutors said, patients were not people. They were profit centers. In total, prosecutors identified 553 victims who received approximately 9,000 injections or infusions that cost insurance companies and patients millions of dollars. And he got away with it for at least 6 years before being caught. Now I want to tell you about how this monster was finally stopped. Because this part of the story gives me hope in humanity. It shows that there are still good people willing to do the right thing, even when it's difficult. In July 2013, Fata diagnosed a 54-year-old woman named Monica Flagg with multiple myeloma, a serious blood cancer that he told her would require chemotherapy for the rest of her life just to have any chance of survival. On July 1st, just hours after receiving her first round of chemotherapy, Monica broke her leg in 2 places. Now, normally, Fata would have handled this himself, but here's where fate intervened. Fata was on vacation in Lebanon at the time. One of the other doctors at the practice, a 41-year-old Burmese-born oncologist named Dr. Soe Monglay, went to see Monica in the hospital. When he looked at her medical charts, he was stunned. Her readings were completely normal. As he put it, he could tell just by looking at the chart that Monica's numbers were not consistent with an active cancer patient. Dr. Monglay was confused. This didn't make sense, so he did what any good doctor would do. The next day, he went back to the clinic and reviewed Monica's records thoroughly. He could find nothing in her test results that could justify a chemotherapy regimen. But here's what made Dr. Monglay different from other doctors who might have seen warning signs. He didn't just shrug and move on. He acted. Dr. Monglay had started working for Fata in 2012. From the beginning, he had noticed things that didn't seem quite right. In his very first week, he sent an email documenting his request for a staff meeting and a change in practice. He insisted that a physician be present in every office where chemotherapy was being given. That was just good practice, the way I had learned it, he said. Fata agreed, but then moved Monglay to different offices in Lapeer and Clarkston, where their hours and patients never overlapped. After discovering Monica's case, Monglay investigated the clinic's patient records and found numerous instances of unethical and potentially illegal behavior. For instance, Fata was treating several patients with IVIG, a drug intended to treat patients with specific immune deficiencies, when there was no apparent medical basis for it. Monglay persuaded a nurse and a nurse practitioner to confront Fata directly about the excessive use of IVIG. When Fata agreed to stop using it, except in clearly accepted medical cases, Monglay saw this as further proof of Fata's deceit. As he explained, if a physician truly believed his own protocol is helping his patients, he would never discontinue a treatment just because another physician and staff objects. We caught him in the act, but Monglay knew he needed help. He was just one doctor. He needed someone who could take this to the authorities. George Karacha was the practice manager at Michigan Hematology Oncology. He did everything from coordinating physician recruitment to ordering supplies. But George possessed an extraordinary expertise that would ultimately save lives. He had been a federal whistleblower before. Back in the mid-1990s, Karacha had worked at a different medical clinic where he discovered billing fraud. He quit his job and reported it to Blue Cross Blue Shield of Michigan. At first, nothing happened. Almost 2 years passed before he was contacted by the FBI and encouraged to file a whistleblower lawsuit. That case was successful. Stopping the fraud and teaching Karacha an important lesson, I learned that some things are just more important than a job. So when Dr. Monglay came to him with his concerns, Karacha knew exactly what he was looking at. Karacha had grown suspicious after clinical staff and other doctors began giving their notice and leaving the practice without explanation. When he asked Monglay why he was leaving, Monglay told him that Fata kept insisting on aggressive chemotherapy regimens, even for patients who didn't need it. Karacha didn't believe him at first, but he decided to investigate. He interviewed several staff members. The first thing he noticed was that Fata's treatment-to-consultation ratio was completely different from other doctors. Then Karacha asked a nurse to check on Fata's use of IVIG. She reported back with shocking news. In 1 week, 38 out of 40 patients who received IVIG did not need it or did not qualify for the drug. That was all Karacha needed. On Friday, August 2nd, 2013, Karacha went to the Detroit office of the FBI with his findings. 3 days later, on August 5th, he officially filed a whistleblower lawsuit in federal court. That evening at 8 p.m., 2 federal agents, one from the FBI, another from the Department of Health and Human Services, showed up at Dr. Monglay's home. When he opened the door and saw them, he smiled slightly and said, "I've been waiting for you guys." He spent the evening laying out everything he had discovered: the excessive drug treatments, unusually aggressive treatment for terminally ill and elderly patients, protocols that didn't meet any accepted medical criteria. The agents took notes, and then they moved with incredible speed. At 7 a.m. on August 6th, not even 12 hours after meeting with Monglay, federal agents arrested Fata in his Chevy SUV. Think about that timeline. Friday evening, Karacha files the lawsuit. Monday evening, agents interview Monglay. Tuesday morning at 7 a.m., Fata is in handcuffs. That's how seriously the FBI took this case once they understood what was happening. Fata was originally held on $170,000 bond. However, federal authorities discovered that he and his wife had assets of $9 million that had not yet been seized. Fearing he might flee the country, they persuaded the judge to raise Fata's bond to $9 million. He was confined to jail pending trial. Now, I need to tell you what happened when this case went to court, because the victim testimonies are absolutely heartbreaking. In September 2014, Fata pleaded guilty to 13 counts of healthcare fraud, 1 count of conspiracy to pay and receive kickbacks, and 2 counts of money laundering. The sentencing hearings took place over several days in July 2015. Dozens of Fata's victims filed into the U.S. District Court for the Eastern District of Michigan. Many wore yellow to symbolize the sun. They hoped Fata would never see again, a symbol of their hopes for healing and closure. 22 people testified during the victim impact portion of the sentencing hearing. Let me share just a few of their statements with you. One victim named Patricia told the court, "I trusted him with my life. It was medical genocide. I was a cash cow. The bone marrow biopsy was torture. I had to tell my son I had terminal cancer. I don't know how anyone could do something so horrible. You showed no mercy for me, so I have no mercy for you." Another victim named Steve said in his statement, "He's a monster and a master of deceit. I lost 3 years of my life to cancer treatments. I hate this man. Some may choose to forgive. I never can. Maybe God can." Throughout these testimonies, Fata showed no emotion. He appeared to stare at the floor instead of directly facing the victims. But then came the moment for Fata to speak. What happened next in that courtroom will shock you. In part 2, I'm going to tell you what Fata said when he finally faced his victims. I'm also going to give you the 7 specific warning signs that can protect you and your loved ones from ever becoming a victim of medical fraud. These warning signs come directly from analyzing the Fata case, and they could literally save your life. If you want to be notified when part 2 is released, make sure to subscribe to this channel and turn on notifications. This is information every senior needs to know. Don't miss what happens next. I'll see you in part 2.